Posters in the Downing Street windows, a stand-in deputy for question time. Inside Parliament, even more unfamiliar practices.
I'm sorry, we're now going over to Peterborough.
When are the banks going to act in the national interest? Acting First Minister.
Off in his prime, I think the First Secretary can get the best out of that.
Many ask their questions from their constituency homes.
David Mundell, we've been unable to connect. Keir Starmer.
In the chamber for his first question time, the new Labour leader, pressing the government on its pledge to reach 100,000 COVID-19 tests a day by the end of the month.
So we're way behind the curve, and the end of the month is a week tomorrow. So what does the First Secretary expect to happen in the next 8 days to get us from 18,000 tests a day to 100,000 tests a day?
Of course, he's right to say that in the final week that will require a big increase. But of course, with a project like this, it does require an exponential increase in the final days and the final week of the programme.
Labour accused the government of not taking up manufacturers' offers to make personal protective equipment for the NHS, and many other failings too.
Something's going wrong, and there's a pattern emerging here. We were slow into lockdown, slow on testing, slow on protective equipment, and now slow to take up these offers from British firms.
I don't accept his premise that we've been slow. We have been guided by the scientific advice, the chief scientific advice, the chief medical officer at every step along this way. If he thinks he knows better than they do, with the benefit of hindsight, then that's his decision. But that is not the way we've proceeded, and it's not the way we will in the future. 8,000 businesses have offered PPE in response to the government's call, and every business receives a response.
One such company, Network Medical, told the government it could make face shields. It got in touch at the end of March and got a reply at 7:30 this morning, a bog-standard automated acknowledgement. In the meantime, it supplied a chain of UK private hospitals.
Unfortunately, we've not had anything still from the UK NHS. And the problem is that if we don't have anything soon from them, then we'll either have to stop manufacturing because there'll be no demand, or we'll have to supply to customers outside of the UK where we've had interest as well. But obviously we want to keep this in the UK.
The Health Secretary became the first minister to declare that Britain had reached the peak of the coronavirus epidemic. He told the Commons that the NHS now had 10,000 free beds for routine care and routine surgery would resume shortly.
I just want to thank everyone from across the country for their steadfast commitment in following the rules, including in this House. It is making a difference. We are at the peak.
But at the Downing Street press conference, a warning: we are a long way from the vaccine or miracle drug that will allow a return to normal.
Until we have those, and the probability of having those any time in the next calendar year are incredibly small, and I think we should be realistic about that, we're going to have to rely on other social measures, which of course are very socially disruptive.
Last night, a delivery of personal protective equipment arrived on an RAF plane from Turkey. But questions persisted about why Britain had not taken up an invitation to join an EU joint procurement exercise to buy up medical kit to help deal with COVID-19. Yesterday, the top official at the Foreign Office told MPs it had been a political decision. Last night, he sent a letter to MPs saying there was no such decision and the UK simply did not receive an invitation in time to join in the EU procurement schemes.
You can smell these things. That didn't look like a letter he'd spontaneously written himself, did it?
I'm sure there will have been conversations.
Philip Rycroft used to run the department planning for Brexit. Today he's joined other ex-Whitehall grandees, saying the COVID-19 crisis means the government must drop its commitment to leave the post-Brexit transition at the end of December.
To compound that uncertainty, to say to British businesses in particular, we can't tell you what the relationship will be with the EU at the end of this year, is taking a very big risk. That does not look sensible from an economic perspective.
Do you struggle to imagine a British government actually doing it, going through with it at a time like this?
Frankly, I do struggle with that.
Previous EU procurement rounds have included testing equipment. The EU says Britain was fully aware of all of them, despite saying they were not communicated. The government says it does now want to be part of future procurement rounds, just as the chief government medical advisor signals the challenges of this crisis will be with us for a long time yet.
Gary Gibbon at Westminster. Now, an East London GP, Dr. Yusuf Patel, has sadly become the 5th GP in the United Kingdom to pass away from coronavirus. His practice colleague, Dr. Mohammed Naqvi, described him as a very special person and leader. Earlier, I spoke to Dr. Naqvi and to Dr. Patel's son, Ahmed, who himself works for NHS England as a non-medical manager. I started by asking Ahmed to tell me about his
My father, Dr. Yusuf Patel, was one of the most compassionate, friendly and funniest human beings you could ever meet. He was a beloved family man to all his relatives, a trustworthy friend and a brilliant mentor to all his colleagues. So
he was obviously a really big figure in your life.
Yeah, he was a real mentor to me, a brilliant role model and someone that I aspired to be.
Do you think that this coronavirus crisis partly involves the deaths and sufferings of doctors, of nurses, of people in the NHS?
Yeah, I think that COVID is a tragic illness and it affects the whole world, not just our family, but to so many families and NHS staff working on the front line. It must be very difficult for them. But I believe that's also brought families together and it's made us all reflect as a human community on the importance of family and key workers and how important NHS staff are.
Dr. Naqvi, you have lost somebody that's been your partner now for 13 years. This must be incredibly difficult.
So, John, the pain is immeasurable. Yusuf was a great individual. He was so caring of people. He taught us everything we know, an absolute role model and a great mentor.
Do you think that it was almost inevitable that somebody in his situation, treating so many people, that he really was very vulnerable to this disease?
Yes, most definitely. From what we've seen, COVID-19, and like what Ahmed has said, affects everyone.
Ahmed, do you think that your father was given enough help, indeed even enough protection, to protect him from the disease?
I think with coronavirus, it's such a new illness that it's incredibly difficult for NHS England, the government, to prepare so quickly. I think with PPE, it's well known that there's a shortage of it. All NHS staff continue to work, regardless of whether they have it or not, because they love serving the community and patients. And that's what my father would like to be remembered for, is that he served patients.
In a sense, Dr. Naqvi, the very fact that he had to resort to eBay to get a face mask indicates how very difficult it has been to protect frontline people like Yusuf Patel.
John, it has been difficult. We hear the news. We know that there has been shortages in areas, but what we are doing is working together, stakeholders and with other partners across health and across social care to identify where there are those shortages and make sure that we cover those gaps. Whether it's eBay, whether it's Amazon, we're making sure that our staff have the PPE we need.
So in a sense, you have to augment anything that the government can give you by searching online. And I'm wondering whether that means that possibly Yusuf didn't have as good a protection as perhaps he should have had?
We at the practice, when Yusuf was in, we made sure that he was protected. But I understand up and down the country there are shortages.
Dr. Naqvi, how will you manage without him? Have you managed to recruit somebody, at least for the time being, to keep your practice at full strength?
John, Yusuf has left us well prepared. His last words were to carry the fight on, and that's why I sit before you in scrubs today, continuing his legacy, because we need to fight on. We need to fight on.
Thank you very much for talking to us, and Ahmed, thank you very much indeed for talking to us too. Our condolences.
Now, more than 18,000 people have died in UK hospitals after testing positive for coronavirus. But is that official figure really accurate? Taking into account all deaths in care homes, in the community, and because death certificates may not be stating the right information, the real total could be many thousands more. In a moment, we report on the situation in one English NHS trust. But first, here's our chief correspondent, Alex Thompson.
Care homes testing PPE. Care homes testing PPE. Care homes testing PPE. Ever get the feeling time's standing still? For the government, this begins to look ever more serious. The fundamental indicators of victory in what this government claims is a war simply not going away. So, to care homes first.
Very stressful. Trying to get staff to cover shifts. We've got staff going off all the time. We've had agencies refusing to come in because they're scared and worried. On Sunday, we had one wanting to walk off shift because there was suspected COVID in the building. I'm not too worried because I'm quite healthy. I can probably fight it off a lot better than any of the residents in our place. They're really vulnerable. And if it starts spreading around in there, it's just not worth thinking about.
Yesterday, the Office of National Statistics, the ONS, said care home deaths in England to April the 10th were over 1,000. Today, this estimate from the Care Quality Commission for the 5 days after the 10th.
ONS data published yesterday covers the period until the 10th of April. CQC's current preliminary analysis is up to the 15th of April. It is anticipated that the number of deaths in care homes relating to COVID-19 reported by providers between the 11th of April and the 15th of April could be double the number of care home deaths reported yesterday.
This morning, the government said it believes 15 care workers have died from the virus. But will that, like so many other government figures, turn out to be an underestimate? And that comes as figures out in Scotland today show 1/3 of all COVID deaths in the country were in care homes. More generally, in hospitals and beyond, the national death rate is also increasing at a time of year when it should be falling.
In a normal week, we'd expect about 5,000 deaths a week out of hospital. In the week coming up to April the 10th, there were nearly 9,000 were registered. And of those extra 4,000, only about 1,100 had COVID on their death certificate.
Then there's illness. Cancer UK estimating 2,500 cases every week going unreported because of the COVID-19 ripple effect. What's behind that?
Patients are, nervous about going to their GP because of the virus. They're obviously on the lockdown, and I think there's a really important public health message to get out there that actually, if patients have got symptoms that they're worried about, the service is still running. GPs are still doing their surgeries. Whether it's teleconsultation or whether they need to see you, they will see you if it's necessary. And it's very important if patients have got symptoms they're worried about to consult, so that we're not going to see late presentations. Otherwise, we really are going to run into trouble.
Testing times indeed for a government promising 100,000 tests a day by the end of the month, but delivering fewer than 20,000 as we speak. Today, NHS England wrote to thousands of staff saying previous tests costing millions were not reliable and may need to be redone. That said, the numbers needing hospitals are declining UK-wide, and the NHS has not, in general, been overwhelmed. But more than 20,000 people have so far lost their lives. Others have come very close to doing so. Discharged from Worcester Royal Hospital, Chief Superintendent Phil Dolby, West Midlands Police, after a fortnight in intensive care.
Saved my life.
Hey!
And I'm going back to my family.
Yay!
And Alex is with me now. Alex, England's Chief Medical Officer, Chris Whitty, had a pretty stark warning at the press conference this afternoon. Bring us up to date on that.
Yeah, this is really quite a moment. You'll be familiar with the Prime Minister saying, I need to level with you, to the British public. Well, in his rather more self-effacing style, the Chief Medical Advisor, Chris Whitty, has had his moment tonight of levelling with the public. He's saying, and let's be really clear, you're worried how you get out of this with your family. I'm concerned. Floor managers, the people in this studio, people watching at home, want to know when it's going to end. He says two things are going to get us out of this. One, a vaccine, or two, drugs that stop people dying from it. He says there is no realistic prospect of either of these things happening anytime soon. To quote the exact words, until we have those, the probability of having them in any time in the next calendar year is incredibly small. We are going to have to rely on other social measures, which are, of course, very disruptive, as everyone is finding out. Well, too right they are. Small wonder around Whitehall and Westminster, they're saying the phrase exit strategy in government is absolutely banned. It's out. We've seen government ministers somewhat at odds at that. That's all gone. This is the message. I mean, he will have told them he's going to say this. It's been said. Prepare, get ready. Calendar year is when this may end.
Alex, thanks very much. John.
Well, one English NHS trust has told us that it is reviewing all death certificates which it has issued over an 18-day period in April to ensure that COVID-19 has been appropriately recorded. This after a campaigning group launched a legal challenge over whether the deaths were being correctly certified. Our correspondent Kieran Jenkins has more.
John, we've been reporting now for over a week on whistleblower allegations that some deaths linked to coronavirus are being attributed to other causes of death on death certificates. Tonight we can tell you that an NHS trust in England has withdrawn its own guidance for doctors recording the cause of death after a legal challenge brought by the Good Law Project. They didn't want to name the trust in question, but we've approached that trust for a response. Now, it's important to understand that doctors certify a death by completing a medical certificate of cause of death, an MCCD. And this particular NHS trust had issued its own guidance specifically relating to the coronavirus pandemic, which said that pneumonia or community-acquired pneumonia were an acceptable cause of death on that certificate. And there is no requirement to write COVID-19 as part of the MCCD. Now that matters because the Office for National Statistics produces a complete death toll for England and Wales once a week, and if COVID-19 isn't on the death certificate, then that death probably won't be counted as a coronavirus death by the ONS, although it may be recorded in the daily deaths submitted to NHS England. Well, tonight the NHS Trust is reviewing deaths recorded over an 18-day period in April. In a statement, they said the claims being made are emphatically wrong on all of the key points, but to avoid any possibility of misinterpretation, we've ensured that all staff are referring to the national guidance instead. And in legal correspondence that we've seen, the Trust told the Good Law Project that whilst they don't accept the entirety of the challenge, they do concede that they should withdraw that guidance.
And Kieran, the coronavirus death toll has been updated significantly in Scotland today.
Yeah, in Scotland, we get a weekly update from the National Records of Scotland, like the ONS in England and Wales, counting all deaths where COVID-19 is mentioned on a death certificate. So the revised Scotland death toll for the week up to April 19th is more than 600 deaths more than previously reported. The revised death toll up 64% to 1,616 in Scotland. Why? Well, a big part of that is deaths in care homes. The Scottish Government's daily figures only include care home deaths confirmed by a lab test. The weekly figures show many, many more. But that, of course, only helps to explain those deaths that are actually being attributed to COVID-19. Across the UK, we know that many more people are dying from all manner of conditions in recent weeks compared to recent years. And we may only understand the full scale of this crisis when we know why that is.
Kieran Jenkins reporting.
Now, as we've been hearing, as well as concerns over death rates, the government is facing pressure on many fronts. A short time ago, I spoke to Sir Ian Duncan-Smith, previously Conservative Party leader and former Work and Pension Secretary. I started by asking him about the government's target to carry out 100,000 tests a day.
Yes, I think there's a likelihood of that happening because the testing facility now is suddenly ramping up. That's because these new centres in Milton Keynes and various other places are now coming online, and they have huge capacity. So we should be able to produce many more tests. The question isn't, will we have the availability? The real question now is, how do we ensure that everybody who needs it is able to get a test in a timely manner? Because there are testing centres, but some are some distance away. So the objective of the government has to be to get testing centres now in the next few days into every single town, close enough to those people that go into care homes, either going on shift or coming off shift, or doctors or nurses, that they can get to it without a huge delay or biting into some of their time off, which is what they need to recuperate. So that's the challenge ahead. I don't think getting testing availability is the big challenge now. The big challenge is getting people able to access that, and that's really the key.
You said testing is suddenly ramping up, but the day before yesterday, it was around 18,000. Yesterday, not quite 23,000. I mean, that is way off 100,000 a day, which is what the government is promising.
No. The testing availability was at 40,000 today and ramping up through the next few days. It's not, as I say, the testing availability, I believe there's every chance that they will be there on time.
But we're talking about the number of tests carried out, though.
Well,
and
that's my point.
That target is 100,000 a day.
With respect, that's what I'm talking about. I'm talking about the challenge, I think, is more the case of being able to get the right centres into the right places in the next few days so that people can get to those who need them without travelling long distances. That's the real challenge, and it's that bit which has now got to be doubled up on, as it were, and we need everybody to lend a hand on that to make sure we have mobile testing centres, centres in car parks, but in the areas where people need them.
And should the military be helping ramp that up, do you think?
They are actually doing that, I understand, and that is a welcome position to be in. The military have been involved in distribution of PPE, and they've helped enormously in get that right, and I believe they're involved in the testing centres now as well. And I have great faith, of course, in the military, because of all the organisations in government, this is the one organisation that invariably plans for and is ready for disaster maintenance.
It's interesting, isn't it? You're an ex-military man yourself, of course. The head of the armed forces was at the press conference this afternoon for the first time. If you were still with your military hat on and you were looking at this as a sort of military campaign, and the battle against coronavirus has been described in military terms, what would the military have done differently in terms of planning the response to this crisis?
The military are set up to put structures in place and do it. And I believe that's what they're doing now on distribution and on the testing setup. And that, we have to hope, will deliver what we want. But the military certainly should be absolutely bound into this. In fact, in some cases, I would say they should take charge of it.
So both with PPE and testing, the problems that the government's been accused of, and there's been a lot of criticism on both of those, do you think that comes down to a problem with Whitehall bureaucracy or a political leadership issue?
We are meeting an unprecedented challenge. Not in my lifetime, not in anybody's lifetime probably listening, except for the Second World War, have we had to face such an enormous, not just national, by the way, but international threat that is causing every government to face these problems. So we need to just be a little less critical for its own sake, and understand that, first of all, the challenge is on a scale that no government has ever faced, and they're having to literally construct the solutions as we move along. But secondly, I think it's very, very important that we also understand fully that I believe the government in every circumstance is doing its best to get it right.
Should the military have been bound in, to use your phrase, at an earlier point in this crisis?
I'm not in government, so I don't know to what degree there were discussions with the military. If you ask my personal opinion, I would on day one have turned to the military and said, come in, take over the distribution, let's get on with it. But they may well have done it, so I don't know. So I can't criticise, I can only observe.
Ian Duncan-Smith, thank you very much.
Pleasure.
Well, we're joined now by General Sir Richard Barrons, retired senior British Army officer and former commander of Joint Forces Command. Sir Richard, Ian Duncan Smith there said that the military should have taken charge from day one. Would that have been a good idea, do you think?
I don't think it would have been a good idea to bring the military in on day one, because I think the issue we as a country need to address is that we told ourselves in many reviews last year and before that a pandemic was our #1 risk to our security and our prosperity, and we did very little about it. So the real question is, why weren't we better prepared, I think?
Well, what's your answer to that question? Where does that failing lie?
So I think the answer to that question is, first of all, we were good at spotting that this risk actually exists, and then we were quite poor at doing anything about it. That's not unusual in our national history or history of any democracy, but I think what it means that for government in the 21st century, we are going to have to break out of our comfort zone of perhaps operating in the way that we've operated for the last 30 years or so since the end of the Cold War, and realise that the UK now exists in a much more challenging world, and we're going to have to do things that we haven't done for a while, like think strategically, plan, organise perhaps more centrally, perhaps be more disciplined. But I don't think the answer to that question is the armed forces.
Well, when you talk about the failings there of preparedness, and we're looking at all of the ramifications of that with testing, with PPE availability, is it a sort of Whitehall bureaucracy shortcoming or a failure of political leadership, given that the Prime Minister is still off sick?
Well, I think we all have to look at ourselves, government, the civil service, industry, civil society, the NHS, because we all have a part to play in finding our way through a crisis like this. And the fact is, we chose not to really prepare for a pandemic, and now all the problems that you just described we're having to wrestle with in the heat of the moment, and it's clearly much harder, and the solutions will be imperfect for a while to come yet. So at the heart, this is about how we as a country do better about wrestling with a more challenging world.
Is this because politicians are focused on the day-to-day and the sort of headlines in the next week, rather than taking a step back and maybe risking taking some flack to prepare for the future?
So I think there's a feature of our politics that's been the case for a while now, that we generally focus on quite short-term things and generally only one big thing at once. So if we were having a conversation last year, we would only have talked perhaps about Brexit and its consequences. And what we need to do is to regrow politics and society that can manage a much more complex landscape and do concurrency of difficult things at once.